Hi, everybody. Wanted to give a quick Facebook update related to some COVID data and a couple reminders. Um, Unfortunately, we continue to lose neighbors over the last 24 hours. We lost three neighbors in the hospital, and the state website says that there's five presumed nursing home deaths. So, uh, regardless, it looks like we lost eight neighbors to uh, the virus over the last 24 hours. We lost a 67-year-old male, a 78-year-old female, and a 64-year-old female in the hospital. Needless to say, we're very, very sorry, and we, with for these families, everything they're going through right now, and they will be in our prayers moving forward, along with everyone else we've lost in this pandemic. The rest of the data outside of that horrible data point is pretty good. The new cases for the day are 124 new cases. This is one of our high case days every week. This is down, I believe, almost 100 from last week, maybe even a little more. So we continue to go in the right trend. Our active cases are down to 2,401. Again, that's the lowest it's been in an extended period of time as well. Uh, 7-day average 3.6% continues to go down. Just a great job when at the beginning of the month we're at 8.6%. So great job to everybody who's really taking this seriously after these holiday issues that we had with these surges. Hospital numbers are down again, 141 in the hospital, 24 in the ICU. So that's a better number in the ICU. Certainly we've lost members of the community in the ICU over the last 2 weeks, but others have gotten better and gotten out of there. So that's good. So hospital numbers are down. Our active cases are down. Our 7-day average is down, and our cases are down. So that is very good. Related to vaccine, let me just go through all of this. This is a very emotional and stressful process for everybody, our teams included, on this. We, the vaccine right now, there's a production and supply issue, and we don't have enough to get to everybody that's eligible. So this is really a horrible situation to be in what should be a happy process, right? We're getting the vaccinated so that we can get our lives back, and people are desperate for that. So we understand that. The pressure on all of you is a lot. The pressure on everybody on our end is a lot. So we're just trying to work through all this. A reminder on this, eligibility. At the county level, we don't determine eligibility. We didn't say who became eligible in 1A. We didn't say who became eligible in 1B. We don't determine the who. That's the state of New York with the CDC at times. The when is when there's production and supply. We are involved in the how. And when you look at the how, the facts are that Central New York is the best at vaccinating in the state of New York, 100% of first doses. So where else is the how? The how is at the fairgrounds with a state site that we do help staff. It is through your pharmacies that have their own protocols on how they do appointments. Then it's at the On Center with our county pod. And basically up till this week and going into next week, the only new appointments were at the On Center. So yesterday we had 1,000 appointments roughly up on our website. What happened was as follows. There were 767,000 hits on our website within 45 minutes. That's never happened. Our website did not crash. Our website slowed down tremendously, quite frankly, because it thought it was being under a cyber attack. So you could have been in a process and you could have been stuck in that process while you were trying to register. We had 130,000 different IP addresses, independent IP addresses, trying to get a vaccine yesterday. 130,000 different IP addresses when we had 1,000 vaccines available. Okay? If Nothing happened yesterday on the website, and the technology worked well. You had a 1.4% chance of getting an appointment yesterday. That's the math. And so certainly we would have had 98.6% of the population that was eligible disappointed they didn't get one. And I'm sorry about that. I can't control that. I wish I could. So that's just the data, just so we can look at it. Next week, your likelihood of getting appointments is going to get a little bit better. And then each week, hopefully, better. We did create Onlist for seniors, 10,000 seniors in a pool that will be randomly selected, and that list will be exhausted. And once it's exhausted, we will fill it up again. Hopefully, by that point, we'll be at a point with supply in the community that the demand won't be as high in 1B, and we'll be looking at 1C, hopefully. But we don't know when that's going to happen because we don't control the production, and then we don't control the supply. The state of New York at this point determines how much supply we get each week. So Onlist, though, we do have that tool. The Farm Kidney Drugs is going to pull from that. Onondaga County will work on that list as well. We'll offer it to the state fair site as well when they get more appointments. So hopefully that will be a tool where we can make sure those seniors are getting through it going each week. We did reserve some phone slots for Onlist. There is a phone bank where they're answering the phone calls and registering people for Onlist. There still is slots available, but at some point the slots won't be available. And the number there is 315-679-4099. Now remember, this is a phone bank. For those of you who have ever worked one or ever been on the other side of one, if you're on the phone registering somebody else, it's tough to get to all the calls that are coming in. It's very busy. Please be patient. These are all people that are trying to help you. So we get it. The anxiety is very, very, very real. We can feel it. And it's tough for us to keep our cool at times. But everybody on our team, everybody working through these processes, all they want to do is help you. This goal of vaccinating, this is the most important thing as public servants we will ever have to do. We take that very seriously. And it's going to be a little bit of a grind to get through this process, but we'll get through all of it. And that's our commitment to you. So saying that, we will have a briefing on Monday. By Monday, we should have an early indication of what supply we will have for next week. Based off that supply, we'll determine if we're doing a 1-day clinic, a 2-day clinic, a 3-day clinic, and we move forward into next week. But please, let's continue to be smart, continue to make great progress, avoid the gatherings that lead to cases, the traps. Certainly support your local businesses. And obviously, if the big thing we can do as far as cases, if you're sick, stay home and get a COVID test. Let's stop the spread. Let's eliminate all risk in that regard if you have symptoms. And if we keep doing this, the data will keep getting better. We'll get aspects of our lives back, and that will take some of the mental load off all of us.